History of Medicine Part 2. Historical medical treatments. Ancient Egyptians, they used urine to test for pregnancy, as do we these days. In the Ming Dynasty, the Great Herbal was established. It identified more than 1,800 plants, animals, substances, minerals, and metals with medicinal properties. This would probably be the beginning of what we consider the PDR. Early medical treatments were often crude. Some physician staples: rhubarb, senna, bitter apple, turpentine, camphor, and mercury. Some physicians did not wash instruments used in treating the ill. Diseases that existed: malaria, typhoid, leprosy. The death toll from smallpox was very high. Edward Jenner discovered a smallpox vaccination in the 19th century. Medicine progressed rapidly. Anesthesia was discovered to alleviate pain during surgery. There was also discoveries that some bacteria cause diseases, and the importance of asepsis to reduce the transmission of infection was found. Louis Pasteur was known for his recognition of the relationship between bacteria and infectious disease. Joseph Lister revolutionized surgery by sterilizing instruments and having physicians wash hands with antiseptic spray. Robert Koch changed the way healthcare departments cared for persons with infectious disease with his work in isolating bacteria. In the early 20th century, many infectious diseases and epidemics became curable. The life expectancy increased. Antibiotics was discovered. Salk and Sabin came up with vaccines found for poliomyelitis. In the 20th century also, Banting and Best discovered insulin could be used with diabetes. Both penicillin and cancer cells were discovered in 1928. Penicillin not brought into production, however, until 1945. The first human heart transplant was performed in 1967. Today we are aware of the limitations of modern-day medicine. AIDS reminds us of the plagues that are still possible. Cholera causes deaths because of poor sanitation. Drug-resistant strains of malaria, tuberculosis, and other diseases still exist. The scourge of epidemics. Paralytic poliomyelitis viruses spread through fecal-oral route, probably present in ancient times. Most often affects children under the age of 5. There is no cure. Those with vulvar polio were placed in iron lungs. Paralytic poliomyelitis. President Franklin D. Roosevelt had polio and waged war on its disease. The first polio vaccine was discovered in 1952 by Jonas Salk, the oral vaccination in 1961 by Dr. Albert Sabin. Polio is still a problem in other parts of the world, however. Cancer. Earliest specimens of cancer found in the Bronze Age, 1900 to 1600 BC. It's treated by surgery, radiation, and chemotherapy. Nearly 1.5 million new cancer diagnoses in the year 2007. HIV infection and AIDS. The illness was first seen in young gay men in 1981, later named AIDS by the CDC. In 1984, the human immunodeficiency virus is named as a cause of AIDS. In 2007, more than 1 million persons live with HIV and AIDS in the United States. The challenges of the 21st century. MRSA and the overuse of antibiotics. Some contributors to medicine. Hippocrates, the ancient Greek physician whose writings contributed to today's medical culture. The Hippocratic Oath establishes guidelines for physicians' practice of medicine. Women in medicine. Primitive women were accepted as healers. In later cultures, they were allowed to care for only women during childbirth. Muslims relegated obstetrics and gynecology to midwives based on their beliefs. In the 19th and 20th century, women were accepted as medical doctors in Western cultures. Elizabeth Blackwell was the first American female physician in 1849. In 1860, 200 physicians in the U.S. were women. By the year 2004, 26.8% of U.S. physicians were women. Frontiers in medicine. New developments, including alternative therapies identified in the last 20 years. Non-invasive imaging, VCT, MRIs, laser eye surgery, implantable lenses, adult stem cell treatments, pill cams, medical Bluetooth, aromatherapy, music therapy.